Hey guys, it's Dr. Scott here. If you're watching this, you're probably one of my students, especially during this coronavirus episode. I'm trying to put some videos together to supplement or complement what we're doing on the online course. Because I'm not with you personally, you're going to miss out a little bit on some of the show and tell that I would typically do. I am going to try to do this on the videos. But I wanted to spend a little time going through some of the landmarks you should know on the cranium, skull, mandible. I don't have a state-of-the-art technology here, so please bear with me when I try to show you this, just using my cell phone. Okay, so I have the setup here. All right, so, and then the other thing is this may not be all-inclusive. I'm trying to follow some of my handouts and notes, but I could omit something. If you have any questions, just reach out to me, but I will try to be as thorough as possible, though, with that said. All right, so the first thing we're looking at here is the front of the cranium, the squama. First of all, we have the frontal bone, okay, on the forehead area. So if you put your hand over your eyebrows, that would be the frontal bone. The squamous section is the flat section of the frontal bone, the squama. The frontal sinuses would be above your right now, I'll just call them eye sockets, but we'll give you the technical terms in a minute, is with the frontal sinuses. Okay, so remember, this is the anterior portion of the skull. Frontal sinuses be deep beneath the superficial layer of bone. On the frontal bone, we have the supraorbital margin, or ridge, okay, which is right here. Okay, we have on both sides. The supraorbital foramen, it may be difficult to see, but there's a little hole. Now remember, foramen is a fancy term for hole. There's nerve blood supply coming through that foramen here in the medial portion of the orbit of the eye. Okay. What we're going to do here, we're going to stay on the front. We got the nasal bone. Okay. Then we're going to have the maxillary bone, which is the bone right under the undersurface of the eye socket. Okay. Coming around to the opposite side. So this is the maxilla. All right. The vomer is a bone right here on the lower portion of the nose. So obviously there'd be cartilage here around the nose. The lacrimal bones are the delicate bones on the inner side of the eye in here. Okay. Nasal bone, I said, was here. The concha are those little things that project the superior, middle, and inferior concha of the nose in this region of the nostril area. Okay, the alveolar process of the maxilla, okay, are going to be where the teeth are going to come into. Okay, so there's the gomphosis joint where the teeth inserts, but these are the alveolar processes. Okay, we will have alveolar processes here on the mandible for the lower teeth. If we turn to the side, okay, we're going to have the parietal bone, which is here. We're also going to have the zygomatic bone, which kind of continues from the maxilla out to here. Now there's going to be a temporal process of the zygomatic bone, right? It's where the zygomatic bone is going to meet the temporal bone, okay, which is going to be approximately right here. The temporal bone is going to have a zygomatic process, okay? So there's the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. And the zygomatic bone is essentially your cheekbones. Okay? So we continue on the side. Here's our temporal bone. On the temporal bone, we're going to have the external auditory meatus. We're going to have, that's where the ear is going to be, right? The cartilage of the ear. Then we're going to have the mandibular process, the mandible, which is your lower jawbone, right where the mandible is going to join right here. So if you can see here, if you've ever had temporomandibular joint problems or TMJ joint problems, that's where the condyle, okay, of the mandible is going to reach. Okay, we'll get more to the mandible in a minute. So again, here's the external auditory meatus. We're also going to have the styloid process, okay, coming down here off of the temporal bone. Might as well mention the sphenoid bone is going to have a pterygoid process right about here, We're going to have muscles of mastication. Mastication is muscles that cause chewing motion that are going to attach there. We'll learn that in later weeks. Okay. Another important muscle attachment area on the temporal bone is the mastoid process. So if you palpate behind your ear right now and you feel a projection of bone coming down, that's the mastoid process, and there'll be some muscle attachment. And that's really why we learn all these muscle landmarks, bony landmarks, because muscles are going to attach. If I turn our head up, okay, so that the superior portion of the head is towards us. This is towards his eyes. This is towards the back. Okay, here's the frontal bone again. We're going to have sutures. The first suture is the coronal suture, okay, which runs along where my pen line is. Okay, it's going to separate the frontal bone from the two parietal bones on both sides. Okay, then we're going to have the sagittal suture running down the midline. And I'm going to turn towards the posterior side of the head. Okay, so if you put your hand on the back of your head, or in that region, we're going to have the lambdoidal suture, which is going to separate the occipital bone, which is back here in the back, with your two parietal bones. And if I come around towards the lateral view again, the side view, here's our temporal bone. It's hard to see, but there's another suture between your temporal bone and your parietal bone called the squamous suture. All right, so these are all on the sheet. Again, I have my notes to the side, but I'm trying not to be, look over there too much so that I can kind of keep this fluid and keep the video from being too long. If we come towards the posterior side again, here's your occipital bone. Here's your external occipital protuberance, or we call it the EOP. All right, where muscle attachment's going to be there. From the EOP, okay, there's going to be the superior nuchal line running on either side, and down below the inferior nuchal line on the occipital bone. Again, for muscle attachments, and we'll go into those muscles at a later date. Continuing on the occipital bone, if I turn us, now we're looking underneath. This is the foramen magnum. All right, the spinal cord is going to come through there to go into the cervical spine, okay, and the midbrain is up here in the hole, all right? So foramen magnum, we're going to have the occipital condyles, okay, that are going to sit on C1. Excuse me if you can't see it, occipital condyles on C1, which is the atlas. You'll learn that in later weeks, okay? While we're underneath, you see your mastoid process from underneath, your styloid process, and your pterygoid process is down here, okay? And then you see on the inner surface of your maxilla, right, for the alveolar processes. We're also going to have the ethmoid bone, okay? We're going to see the ethmoid bone pretty much in two places. You're going to see it deep in here, we're underneath. And also what I'm going to do is open up our skull now, okay? Again, for orientation, here's the front towards your eyes, and then back here is towards the back of your head. So our brain would be sitting in this cavity, right? We call this the petrous portion of the bone. Okay, the brain's sitting in there. Here's foramen magnum. I just showed you going down to your cervical spine. Okay, that ethmoid bone again, we're going to have the cribriform plate, which is right here. Okay, and you're going to have the nerve endings for your olfactory nerve, for smell, are going to come here, pierce through this. Okay, and then guess what? There's your nose. All right, so when you have smell, it stimulates those ethmoid air cells that are sitting there. And the crista galla, which attaches this portion of your ethmoid bone to your brain, are going to project up. The sphenoid bone, right? The sphenoid bone, we'll see a little bit of portion here on the lateral side, right? This is the temporal bone, this is the zygomatic bone. And then you're going to have the sphenoid, a very small portion you see here. But right here is your sphenoid also. These are going to be your lesser wings of the sphenoid. Okay? You're going to have this little saddle here called the Turkish saddle, or sella turcica, where your pituitary gland is going to sit. Okay? Again, this is towards the front, towards your nose and your eyes. The greater wing is going to be in here. Now, thankfully, we're not going to go through all these different foramen in the brain, okay? But for this class, or classes mostly at this school, but here's your sphenoid bone. Okay, so coming towards the front,